Welcome to Health is Wealth with Dr. Mike. I'm station manager Tina Cortez, and my co-host is Dr. Mike Carrozza. Good morning, Dr. Mike.
Good morning, Tina, and hello to all our listeners out there.
Now, coming up on today's show, you wanted to introduce us to a couple of chiropractors, right?
Yes, I mean, their expertise is prenatal care and pregnancies, and they have their first Health and Wellness Expo coming up in a couple of weeks. I can't wait to introduce them and talk a little bit about what they do and what's going on with this new expo.
Excellent. Looking forward to it. Now, this is week number 10 of Health is Wealth, and every week there are products, vitamins, supplements, diet plans that you propose, that you talk about. And one of our listeners has a question about where to find the variety of items that you mention on this show.
Yeah, so first, Nature's Emporium is, there's 3 locations in York region. Okay, so we got 3 locations here, and then there's 1 location in Burlington. So the unique thing about Nature's Emporium is not only are you going to get all your organic vegetables there that we speak about, and then things like your grass-fed food, your beef, and your organic chickens, and your meat and your produce, you're also going to get a lot of the snacks and some of the healthy grocery department sections as well. But most importantly for myself and my practice, I have a small dispensary, Tina, so I carry some key products, but I can't carry them all. And the lovely thing about Nature's Emporium is not only do they have a huge section in terms of supplements, but they have a nice professional side. So this is the side that you might not see. So if you're missing this, to our listeners out there, you're probably missing this section is because you got to ask one of the staff members. And by the way, the nutritionists there on staff are phenomenal. They're well educated. They're going to give you some advice. So you'll have the regular section in terms of all vitamins. Let's say if you're looking for a vitamin C, you're going to see there's like 10 of them.
Well, yeah, and that's what I was just going to ask you. How do you not feel overwhelmed when you're walking through those aisles and you see those shelves and many products of the same type of item? How do you choose?
First of all, it's education. So education is key. That's going to be the most important part. So the thing that I like to say, so when I recommend a patient to go there, you will send them with a pad and some information on a notepad, and they'll go out and they'll say, I need this professional product, and then that's going to be behind the counter. So those are specific specialty products that are held behind the counter. You won't see those on the shelf. But you're right. I mean, I was just in yesterday, and there's 6 vitamin C's, and there's different qualities and types. What you want to know is you want to know exactly what you're looking for. Maybe, for example, because we're on that topic of vitamin C, ascorbic acid. It is an acid, but we know that the buffered form with the calcium is a little bit more bioavailable. It's not just an acid, and it won't hurt your intestinal tract in terms of your stomach if you have acid reflux. And then you'll break it down to, let's say, 1 or 2. Now you got to pick what dose. Are you a child? If you're a child, maybe 150 milligrams to 250 milligrams dosed twice a day. If you're an adult, then you're looking at about 1,000 milligrams 1 to 3 times a day, depending on your immune system. It's not just a health food store. It's not just a pharmacy with an F, pharmacy with an F. Tina, we talk about this. F-A-R-M, pharmacy. And that's the key, because what you're getting is you're getting right from the farm to your table, and they're partnering up with some key people that are actually making differences in this world in terms of sustainable resources, sustainable farmers, and even companies that actually believe in this. So when you go to the juice bar, you want to get a coffee, it's going to be an organic coffee. You're going to get a tea. Our teas and our coffee that we're drinking today is, of course, brought to you by Nature's. And it's important because you can get a nice juice as well. And their juices are all cold pressed, and they're all 100% organic, and you're getting the top quality stuff. So, while you're shopping, you can drink a juice and have a little treat, and you can do your shopping and your groceries.
All right, we're going to take a bit of a coffee break this morning. When we come back, the vitamins women need and foods to avoid in pregnancy. This is Health is Wealth on 105.9 The Region. Stay with us. You're listening to 105.9 The Region, and welcome back to Health is Wealth with Dr. Mike. I'm Tina Cortez, and my co-host is Dr. Mike Carrozza. Now, Dr. Mike, our focus next turns to pregnancy and what vitamins to take and what foods to avoid. Let's start with the vitamins.
Okay, most importantly, supplementation is going to be absolutely necessary for a lot of our pregnant moms out there. Okay. And whether you're pregnant or you're deciding to become pregnant, or this is something you want to, you have to take the vitamins ahead of time, number one. And number two, it's extremely important because we're going to have two human beings that we got to care for. Especially in my practice, what I see a lot of is you have a baby that's going to be born, and then you have a mom as well that you got to take care of both. And so why supplementation with these patients are extremely important is because a baby will, Mother Nature will pick obviously to get all the nutrients to the baby. So, for example, if you don't support an iron with a female who's actually probably most likely iron deficient, the baby's going to take all the iron, and then mom's going to suffer. So you definitely want to supplement with things like iron for that reason. But most importantly, the baby is going to probably take the majority of the vitamins, and that's quite prominent as well in terms of calcium. So
now, back in my day, it was take that folic acid, and that was kind of all I was told.
There's more research now, Tina. So we know that the methylated genes are present in both 50-50 people. So not all the people actually have the process, meaning the nutritional power to process folic acid. So you can't just take a regular folic acid because if you don't have the methylation in your system, and this is a genetic predisposition. Now, we can check your genes. We know that. And I always speak to that point. But most importantly, you're better off taking an MTHFR. That's a methyl tetrahydrofolate. You need to take that form because the methylated form, it's the automatic converted form of methyl folic acid and methyl B12 as well. So you definitely want to make sure a prenatal vitamin has that active constituent. It's extremely important, or else it won't work. And then what's going to happen is you're going to have some issues, and we don't want that. So we want to make sure. So, first step is, yes, know your genetics for the methylation process. But if you don't, you're just safe as well just by taking a methylated form of folic acid, and you know that you're going to prevent a lot of the issues that come with the development, especially neural tube defects and what comes along with that.
Is a multivitamin an option?
It's not, in my opinion, it's not an option. It should be a staple.
Okay.
Yeah, it should be a staple. It's definitely very important. It needs to have iron. It needs to have methyl B12 and methylfolic acid. And that's not enough. I mean, you're going to have to take separate folic acid. I always like to give a separate folic acid supplement with my pregnancy patients. You definitely want to take an extra folic acid. So, 400 micrograms is the standard. I like patients to consume well over between 600 to 1,000 micrograms because it's very necessary. So, Tina, this is really important in the neurological development of the baby. So we don't want to take any chances. So when you want to take a supplement, you want to make sure you get the top quality. So most importantly as well, prior to that, since we're on the neurological development side, you need to take a fish oil. Fish oil is going to be extremely important, and you want to make sure it's a clean source. So these types of sources, they need to come from the small fish. You definitely want to make sure that the company in which you're looking at is going to have a process in which they clean the oils. So this is some form of a secondary or third party sort of laboratory sort of studies this, and they look at, so it's either IFOS or you look at like NutraSea, which is a company. Nature's Way took them over recently. And it was a company that I did a lot of research for back in the day. So they actually have something called a Pure Check program. So you can go online, you can look at the PCBs, the dioxins, and in terms of the contaminants that are in that fish oil. And omega-3s, high in EPA, DHA, you're going to find that in the fish-only sources. So you won't find that in the plant sources. So you must make sure that it is something that is clean. And usually these sources come off the coast of the Peru, and these fisheries are predominantly responsible and very sustainable. So most importantly, when it comes to fish oil, though, you want the DHA. So that's docosahexaenoic acid. The DHA value must be higher. This is involved in because 40% of our brain and our ocular our eyes and our heart muscle predominantly are comprised of DHA. So we want to make sure that DHA is predominantly the active constituent in the fish oil. So you can get a DHA-rich source, and this is predominantly what you want to take. But, we talked about the extra folic acid, and calcium, magnesium is going to be important because if you don't take the extra calcium and magnesium, what's going to happen is baby's going to take the calcium from mom's bones, and then mom sort of gets stuck, getting, osteoporosis.
So this is about the bone health now.
For sure, for sure. And then the other thing that's important is you got to take a probiotic. So I like the HMF Maternity by Genestra. I like this product because it's one of the only product that's actually been researched and well documented. Plus, it's good for infancy as well. So once the child is born, you can just crack open the capsules and give it to the baby. So it's both good for mom and baby. And then, once the baby is born as well, kudos to all the moms out there who are nursing and breastfeeding. And by the way, a shout out to my wife, she's nursed for 4 years straight with our 2 kids. Yeah,
wow.
It's incredible. And seeing her go through that, and all the moms out there that have done it. I mean, you guys, including
and not
my
everybody
wife,
can.
My heroes, because you're right. Not everybody can. But when you do it, it's amazing. If you can't do it, then there's organic formulas out there. You definitely want to stick to the organic formulas. You want to look at a sheep or some goat options. And these sources come from Germany or New Zealand. And these ones are really good quality because they're genetically similar to the human milk. Okay, so that means that your baby's going to get less colicky and there's going to be better sort of absorption. Okay, so those are some of the options.
Now, Dr. Mike, what about the foods to avoid?
Okay, so when in terms of the diet, it's very important. We encourage a lot of moms, of course, to eat various different foods because you want to encourage the baby to be exposed to as many things as possible. So you never want to limit or cut out certain foods. So you just want to try a variety. But there are important things to eliminate. First of all, you want to eat some small fish if you're going to eat the fish. Again, because of the contamination aspect. You definitely want to stay away from shellfish. These are bottom feeders. They're going to be very, very, there's a lot of toxins involved. So that's going to be like shrimp, lobster, and the shellfish in terms of clams. These are bottom feeders. You don't want to have any of those. And then tuna and swordfish are very much high in mercury. So 100% you got to avoid that. In terms of undercooked meat, this is extremely important as well. You want to make sure your meat's cooked well. So what comes along with that is hamburger meat. You got to be careful. So I'm not saying you can't eat hamburgers, but be very careful because the hamburger minced meat, there's a lot of surface involved with the hamburger because it's been processed, so you can't really get it cooked too well. It's not like a steak. You can grill it on high temperature on both sides, and you know that it's going to get cooked. So that's pretty important. And then you want to avoid hot dogs, cold cuts, and luncheon meats, and then raw eggs. But some of the secret sources of raw eggs, maybe you don't know. So
not even realizing it's in there.
Yeah. So this hollandaise sauce has it, and then Caesar salads. Don't forget. So this is important. And then another important topic that I want to talk about is caffeine. I get this question a lot in my practice, and I'm not a huge proponent of caffeine, as you know, Tina, but you can have a couple of cups of coffee max. The research shows this, but you need to know what the research shows in terms of when you have coffee and especially too much. So definitely, that it's a predisposition. You can predispose your child to type 1 diabetes, and then you get this low birth weight. And these are, and it can definitely restrict the fetal growth and the fetal development. So this is not a joke, and it's something, if somebody comes into my office and asks me, say, Doc, can I have a couple? I need to have that coffee. I'll definitely restrict it to maybe 1 or 2 max, but the research does show that it could cause some issues. So be very careful. Raw sprouts, you definitely want to make sure you're not consuming any raw sprouts. You got to cook them. You definitely want to wash your produce. And then unpasteurized milk and juices and cheeses, you got to stay away from for the potential bacteria contamination. And then something that 100% I recommend all my moms to avoid is alcohol. And then processed foods. You got to really take it easy with the processed foods. Why? First and foremost, you have gestational diabetes, which when you're consuming processed foods, you're at risk. And then things like preeclampsia. Now, these are things that occur. So gestational diabetes is basically diabetes when our abdomen grows larger. It doesn't matter that we have a baby inside us. Our blood sugar starts dysregulating. And then what comes along with that is high blood pressure and blood sugar. And so this can actually be a problem to not only the mom, but also to the baby there on after. And some moms get stuck with this there on after. So you just want to be careful. And processed foods have been linked, and the research shows that it's been linked with that. So in terms of research, what do we got? I mean, we got 2 key products that I think are instrumental for pregnancies. We got fish oil. You're definitely going to reduce the risk of allergies in infants in terms of eczema, and then visual and cognitive development, and then the neural tube defects. checks. And again, with the fish oil, you want to make sure it's rich in DHA. And then the probiotics, just by taking a probiotic, Tina, it can reduce things like preeclampsia, which is the high blood pressure, and it can prevent gestational diabetes and larger birth weights. So you know that you're going to get protected just by taking these. It's linked to just reducing things like allergies and eczema, and I think is probably the most critical.
Okay, Dr. Mike, one final piece of advice before we take a break.
Taking a multivitamin, making sure you're taking a folic acid that's a methylated form. That's a big one. Take a probiotic and an omega-3 fat, especially fish oil, and cut out the foods because you want to get back. So mom is just, the baby's borrowing mom here. It's like they're borrowing your body. And you're going to need your body back. And you know what? Most women who come into my office, and I see a lot of this, they want their bodies back after they're done. So if you want that, then I guess, eating a healthy, very, very good diet in high dense nutritional foods and low processed foods is probably going to be a very, very important aspect.
When we come back, a preview of the Natural Health Expo. This is Health is Wealth with Dr. Mike on 105.9 The Region. Stay with us.
The aisle.
You're listening to 105.9 The Region, and this is Health is Wealth with Dr. Mike. I'm Tina Cortez, and my co-host is Dr. Mike Carrozza.
Tina, I'm so excited. I mean, we have a full house here today, and I'm so excited to bring on two chiropractors. First off, Danielle Warner, Dr. Danielle Warner. She's the owner and clinic director of Foster Family Chiropractic and Associates, and Dr. Laura Foster. She originally opened Foster Family Chiropractic 20 years ago and is now an associate. First off, let's talk about why you chose to be a chiropractor. And maybe we'll start with you, Dr. Laura.
Okay, well, we're going back about at least 25 years ago. But I will say that...
Get out of here. No way.
Yeah.
Good. That was quick. Nicely done.
That was nice. Thank you for that, by the way. For me, it was all about wanting to do something that was in alignment with how I viewed health and well-being for myself. I was into fitness and I was doing a science degree. I lived in Victoria at the time. And thankfully for me, I ended up getting hurt and I found myself in a chiropractic office. And the experience that I had there and the doctors that I met really changed my trajectory. I was on my way to becoming a medical doctor. I didn't understand the difference in philosophy. And so the care that I received there really sparked me to want to be a chiropractor. And that's why I went for it.
And we hear that a lot, right? About how that one situation or experience changed your life.
100%.
Wow.
And I love it. Excellent. And Dr. Danielle, maybe you can share why you chose to be a chiropractor.
Absolutely. So for me, my mother actually became a chiropractor when we were teenagers, my sister and I. So I was very familiar with the education involved, the principle. And then about a year, I think, before I went to chiropractic college, I wasn't quite decided yet. I had the opportunity to work with Laura. And so from there, that really solidified, again, my vision of what was possible. She took me under her wing and, so I was very fortunate that I had two mentors that were already chiropractors to sort of guide me through the education process, which can be grueling.
And how nice is it? I mean, to obviously you guys work together now. So Dr. Laura, she started the practice and then she sort of transferred the torch. Yeah. And then now you took over and now she works with you. I mean, it's you guys are amazing people and it must be awesome to work there.
Well, it's a mutual love and respect, I think, over the last
For sure.
20 years. Like really, we've been,
Yeah, not very many people get the opportunity to do that where you work so closely for so long and you can pass the torch like that and our community gets to benefit from that. Perinatal care, prenatal care, postpartum care. We care for a lot of infants in our practice. There is another chiropractor that works with us. All of us have advanced training in pediatric care and caring for pregnant moms. So a big part of our practice is very much starting at infants and working our way up. But if you walk through the halls of our clinic, I would say, we're family care
full
through
range.
and through.
Yeah. And generations of people at this point, right? When you've been collectively practicing over 20 years, we're getting into 3-4 generations, and that's amazing.
That's amazing. I can actually, I want to speak to point because I have two kids. One of my children, obviously, it's the first time around. We try to study our best. We try to learn our best and try to apply our knowledge in terms of what we've learned in school. And so, the first time around, you really don't know how it's going to be, right? As you ladies have children, so you get it. I'm just a man in this sort of picture, but from my perspective,
You're outnumbered here today, buddy.
Yes. But in terms of trying to, coach and help my wife, I definitely think that we were ready for the second child. And what I mean by that is that we had a doula, chiropractor, we had 2 naturopaths right in there in the room. We had 2 midwives. Like, we were ready for this.
So how does a chiropractor help a pregnancy?
I can't tell you. I'm going to speak to point. I'll let you ladies take over. But a whole different delivery.
We actually work really closely with the midwifery community and the obstetrical community, actually. And the research has been pretty clear. It shows that concurrent chiropractic care throughout your pregnancy changes the outcome of labor and delivery. Not only does it reduce the length of the delivery substantially, but it also reduces the complications. And our experience with that is that it also sets the mom and baby up for a much more positive postpartum period, which I think is huge when you talk about caring for families and, pediatric care and so on.
There's a dual focus when working with a woman that is essentially building a baby. And one is her, right, and her level of balance and how she's interacting with her environment. But then it's pelvic stability, right, pelvic balance, right? So there's an important relationship between the growing uterus and, our sacrum and our pelvis. And if there are any distortions within that actually changes the movement that the baby has, the opportunity for the baby to move in utero, which is certainly important for neurological development and also getting into that head down position.
Yes.
And also just, when we get pregnant, we're carrying patterns that we've had that perhaps we're able to compensate and deal with, but all of a sudden now we're changing at a much rapid and different rate. And so when you address the body in this way, both neurologically and structurally, you're able to accommodate that. It creates a resiliency. And so oftentimes we'll get, moms that come in and they've come in with their second. Perhaps they didn't have a good relationship, a good experience with their first. And they want to really, set themselves up for success. And it's different, right? They're moving different. They're feeling different. And then their experience ultimately is so much better. And then after that point, they bring their whole families in.
Because you guys are so great.
Yeah.
So you guys work together, which is amazing. And you've been doing this for a while together. So you guys did an amazing initiative and you put this on. It's the Health and Wellness Expo, right? And this is the first year. What made you guys do this? First of all, it's amazing. Kudos, because it takes so much preparatory time and so I give you some credit. But I mean, what was the premise on bringing this to our community?
Okay, I'll start to speak to that. This is a passion project that has been in our conscious and subconscious for a number of years. We've been reaching out to our community and connecting our practice members with all the incredible wisdom, practitioners, services, experiences that can elevate their well-being, like referring to someone like yourself. And we decided that we wanted to make something more collaborative. So we decided this year that we were going to launch this Natural Health Expo and really allow all the exhibitors and the practitioners and different so on that exist already within our community and bring it under one roof.
And so let's get the 411 on this expo. When and where is it?
It's on Saturday, November 23rd in Newmarket. It's at the Old Town Hall, which you've never been to. Is a completely gorgeous and epic building. Mm-hmm. And it starts at 11 a.m. and it goes straight through to 4 p.m.
So thank you for being here, both of you. And just to talk to our listeners a little bit about where they can get more information and how they can get tickets to the event.
100%. Thank you for having us. You can get all the information as well as your tickets online at naturalhealthexpo.ca.
Okay, and Dr. Mike, just before we wrap up the show, for listeners want to connect with you and your team, how can they do that?
So www.applemed.ca. They can reach us at 905-417-4000. They can get us on Instagram at AppleMed Clinic, and now we got Instagram TV coming out, so these actually recordings will be on IGTV very shortly. So thanks very much to our listeners, and thank you to Tina as well.
Thanks for another great show. If you missed any part of Health is Wealth, go to our website, 1059theregion.com. I'm Tina Cortez. Thanks for listening.